And hello, this is a presentation for supervision and for just general information by Dr. Latasha McElwain in regards to intellectual developmental disabilities, previously called mental retardation, and learning disabilities. So we are going to give this overview of and help get an understanding of intellectual disability, IDD, and we're going to also talk about learning disability. So with that being said, we're just going to jump in. We're going to give an overview. We're going to talk about some of the symptoms, some of the signs. We're going to talk about some of the risk factors. We're going to talk about how to kind of get some help in the scenario that you're dealing with some concerns, and how to be able to manage and deal with the overall intellectual developmental disability as well as learning disabilities with individuals. So moving right along, we're going to talk about intellectual disability. Pretty much IDD is what we call it. Pretty much when we're thinking about it, again, once it was called mental retardation, that is no longer the term that we use. We go with IDD or ID, which is the intellectual developmental disability. And basically, we're talking about individuals that are dealing with a below average intellect for the most part. So their IQ probably is less than what we consider to be right on target for being in a quote unquote normal range, or the mental ability or the lack of skills to do necessary day-to-day activities. So people with intellectual disability are pretty much individuals that can learn and they can learn new skills, they can do new skills. Sometimes it may take a little bit more time, but they learn their skills slower than the other individuals, which doesn't make them really, to me, any different. It just makes sure that they are taking their time and they're able to grasp onto what it is that's being learned or whatever is being taught. They basically vary in degrees of intellectual for the most part. So their intellect can be mild to very severe in the kind of profound type area. For the most part, because we no longer use the term mental retardation, we used to say profound. So that means the person is exhibiting more, even more than like the severe, going into the severity of it is definitely something that we used to say, but now we don't say that anymore. Again, we just go from mild to severe when it comes down to intellectual disabilities. And for the most part, we don't use mental retardation because we say that does have a undertone to it. It sounds very negative, as well as it could be offensive. So we don't use those terms anymore. We go with intellectual developmental disabilities, or we go with ID, which is just intellectual disabilities. So someone that has intellectual disability has limitations in two areas. Those two areas are the intellectual functioning area, which again refers to the IQ. The person would basically would have limits when it comes down to they can learn, but again, they're learning slower. They can reason, but they may reason a little bit later in the game. They can make decisions, but the decisions might not be prompt and right away. They can also solve problems, but a lot of times it might be, a process for them for the most part. But in any case, all of the, when we're talking about the IQ, it means it's talking about all these things of being able to do this, being able to learn, reason, make decisions, and solve problems pretty much on that, on a quote unquote normal level, to be like, more making a decision or doing things right then versus taking time to process through it. Most of us are able to adapt to a situation for the most part, but a lot of times individuals with intellectual disabilities, the adaptation is a little bit different. Basically, the skills necessary for living our daily lives, a lot of this, they are able to do these things, but effective communication is a big thing for them a lot of times. Interacting with other people is usually a concern as well. And then also being able to take care of themselves. So, not having to be prompt to speak to someone, not have to be prompt to do certain things, and not have to worry about those communication breakdowns. So individuals, the being able to adapt could, cause some concerns for the most part. So the limitations in those areas is what we're considering when we're talking about a person with intellectual disabilities. We're going to move on, and now we're going to talk about some of the signs and symptoms. Basically, some of the signs and symptoms, they're very different a lot of times when it comes to individuals with intellectual disability, because sometimes it can look like one thing and then it's something else. So we have met many of people. I'm a person who have had that experience where nothing was going on for quite some time and everything was on a normal milestone for a child, and then all of a sudden things just started changing, and it changed kind of drastically, or it changed subtly also. So we've seen that in a lot of children's developmental years and stages. So we can't say that everyone's the same. So everyone has there are different signs and symptoms to look for and that are noticeable. A lot of times, sometimes, like I said, things might not even happen until a child reaches school age, when they get into a school setting and then realize that there's some concerns with socialization and things like that. So depending on the severity of the disability, sometimes we don't notice, and the mildness of it, we probably, it might go unknown. So some of the things to look at when we're thinking about intellectual disabilities are rolling over, sitting up, crawling, walking late. Some children do it right on time and everything goes through their normal childhood milestones and no issues. Talking later or having trouble talking, are slow to master things like potty training, dressing, and feeding themselves. Again, we said these are different signs, and it's different for everybody is what I like to keep telling people, because like I said, I have personal experience where it's different for everyone. And then another thing too to think about when we talk about signs and symptoms, basically difficulty to remember things, inability to connect actions with consequences, behavior problems such as explosive tantrums, and then also looking at some of the difficulties with solving problems and logical thinking. So moving right along, some of the complications in children with severe or profound intellectual disability. We may see other things going on like health problems as well. Some of those health problems could be seizures, mood disorder, anxiety, autism. We're looking at motor skills impairment sometimes, as well as vision problems and hearing problems. Some of the things I do tell families is definitely looking at, and professionals is looking at, getting early prevention with early childhood development. That's always a good plus to have. So some of the factors, the risk factors would be some of the prenatal things that happen during in the womb. So prenatal alcohol or drug exposure, also contracting illnesses or infections while in utero. The other thing is not receiving enough oxygen during birth, suffering a head injury, malnutrition, and then parental low IQ. So if parents are having some concerns and they have, an IQ concern, then that could be something that goes, along with the unborn child. Another thing to think about is prevention. There are certain causes to intellectual disability that are preventable, but some of them are just things that happen. So most of the time we're looking at fetal alcohol syndrome. That's definitely something that's preventable. We try to have pregnant women not drinking and getting their proper prenatal care, as well as taking their prenatal vitamins, no drug use or anything like that. We're also looking at getting vaccinated against certain infectious diseases that can cause, lower the risk. It can lower the risk of the child being born with an intellectual disability, that's having whatever, vaccinations for whatever infectious diseases are out there. And again, I'm not a medical person at all. I do have a doctorate in counseling psychology, so this all rolls in with mental health stuff for us. But, that is something also to consider and think about when it comes to vaccinations also. And then talking about diagnosing, sometimes when you're getting your intellectual disability, intellectual developmental disability diagnosis. There are areas that they want to look at. So there are going to be problems in the intellectual and the adaptive functioning. And so that's where we start looking at, intellectually measuring, kind of what's going on. The individual, there's an individually administered and psychometric validity comprehensive, cultural appropriate, psychometrics, sound test of intellect. So a lot of times they are doing that to get a full scale of the IQ. And when they get a full scale of the IQ, we're looking at what's going on. But then it says, while the specific full scale of the IQ score is no longer required for diagnosing, which they don't have to give an IQ test, some standardized testing are used in order to diagnose the condition. So if a child's going to be diagnosed with autism, or diagnosed with IDD, intellectual developmental disability, or even diagnosed with pervasive what's the other one called pervasive developmental disorder. So different things of that nature. Then there are other testing that can go along with getting the diagnosis and kind of being a little bit more on point. One of the things I will say about getting the diagnosis is once you get the diagnosis, this is just me and my personal experience, everyone will get the diagnosis, but everything is so different. Usually with each individual's diagnosis, that treatment plan is something that is major to consider, because what may work for one person may not work for another person. So there's no one size fits all. We're talking about prevention again. We're going to go back to basically certain causes of intellectual disabilities are preventable. Again, we talked about the fetal, I think I'm skipping this, I think I'm going backwards. The vaccinations. And then we talked about diagnosis. I went backwards. Okay, diagnosis is continued. However, the IQ score must be interpreted in context to the person's difficulties. So basically, their general mental abilities is something also to consider. So moreover, the score on the subtest can vary considerably. So that the full scale IQ score may not accurately reflect the overall intellectual functioning. So what we say next is then basically clinical judgment is needed to interpret the results of the IQ. So the IQ test. So basically, a lot of times if you're getting a diagnosis, sitting down and talking with the provider about what goes on and what your kid can and cannot do is also helpful in being able to figure out kind of where your kid is when it comes down to what's going on. And I've had that experience because of the my ability to have some clinical judgment as well, and be able to focus with my providers in ways that would be able to significantly figure out where my child is when it comes down to diagnosing. Some of the causes, when we think about some of the causes of intellectual disability, we do look at some things like the genetic syndromes, as far as Down syndrome and then Fragile X syndrome. Some of these things do cause some concerns as well. And then illnesses, meningitis, and the whooping cough, and the measles. Okay. Other causes could be some head trauma in childhood that could cause some concerns, as well as some brain malfunction, different things that are going on, some of the maternal diseases, as well as the environmental influences. So again, of course, labor and delivery is also a concern to think about when there are problems during pregnancy as well. Not enough oxygen is being had for the baby in the womb. So a lot of those things to consider as well. When we start talking about treatment, of course, intellectual disability, that is something that's going to last over. It's a lifelong condition. It's going to last over a person's life. There are some early interventions in place that can be ongoing in a person's life to help them improve functioning and help them to be able to thrive throughout their lifetime. Once a diagnosis is made, every individual with intellectual disability is focused on looking at the individual's strengths and needs. So I talked about that a little bit earlier, and being able to support what they can and cannot do, and then be able to move forward and help with their functioning, especially in the home, at school, at work, and in the community. Next, we look at treatments. Many types of treatments can be had. Early intervention is one of the things we talked about for infants and toddlers. Special education courses can be added in as well. Family therapy, even if a family needs some respite support, that could be a consideration as well. Transitional services from childhood to adulthood. Vocational programs can be involved, day treatment for adult, housing and residential options, as well as case management. Some of the coping and supports. So supports can come from family, friends, coworkers, community members, teachers, school, the physician, the team, from service systems. So basically a lot of stuff can come into play. Job coach is one of them that they talk about a lot to help individuals get acclimated into the community and be able to work for the most part. They do start a lot of those job type programs in the high school years for the most part to help individuals understand and learn and figure out what they can and cannot do and how they can definitely be more successful and be able to thrive. Another thing to think about is pretty much people with intellectual disabilities are able to be very successful. They're capable of it. They can be very productive in their role in society. So that's also a great thing when we're talking about coping and support. So basically, again, all this information comes from some resources that we found on the internet. This is just information to give an overview of what to understand, what to think of, what to expect, what to see, what to know what cause, what the preventions are, what some of the treatments are that can be had. So this is basically an overview of IDD. We do have some questions here. This is for our supervision individuals that will be answering these questions and sending them back in order to get credit for their supervision and being a part of this particular session. So if there are any questions or any concerns, of course, you can make contact. But other than that, this PowerPoint presentation is really giving an overview of intellectual developmental disabilities and learning disabilities and some of the things to consider when we're talking about being able to work with individuals, having an overview of how to work with individuals and what to consider, what to expect for the most part. And again, when it talks about intellectual disabilities and talking about learning disabilities, for the most part, what to expect is something we really can't definitely say. I just kind of, use that as far as a diagnosing. But as far as meeting a person, you will see so many differences when it comes down to individuals with intellectual developmental disabilities and learning disorders. You will see some of them very, very, observant, very open and can talk about things and very articulate for the most part. So it's kind of when we say what to expect, we're talking about what to expect is what to expect in general, but when you meet the individual, everyone you meet with just in general, period, every person you meet, but anybody you meet that has a intellectual developmental disability or a learning disability, you will see so many key factors that they have that make them so successful and so unique in their way, and they're able to gain and grasp the things that you're saying and what's going on around them. So everyone has skills and have very, great important skills that make them very successful, even though we're saying that there is a disability involved. So with that being said, this is the presentation for kind of just the overview. And if you have any questions or concerns, again, feel free to reach out to me, Dr. Latasha McElwain.